there will be a disease Y. This will not be the last time a virus threatens our lives and our livelihoods. And I'd like to finish on a high note, but the truth is the next one could be worse. It could be more contagious or more lethal or both. We cannot allow a situation where we have gone through all we have gone through and then find that the enormous economic losses we have sustained mean that there is still no funding for pandemic preparedness. The advances we have made and the knowledge we have gained must not be lost. Just as we invest in armed forces and intelligence and diplomacy to defend against wars, we must invest in people, research, manufacturing, and institutions to defend against pandemics. This pandemic is not done with us. Last month, we observed surges in cases and discussions of lockdowns and compulsory vaccination in several countries in mainland Europe. Across the world, we will continue to see cases increasing and decreasing and governments doing what they can to react for some time. And now, the unwelcome but widely anticipated news of a new, highly transmissible variant, Omicron, and the need to collect more data on what that will mean. Imagine the lives and the costs that could be saved if we could always work at such pace. The spike protein of this variant contains mutations already known to increase transmissibility of the virus. But there are additional changes that may mean antibodies induced by the vaccines or by infection with other variants may be less effective at preventing infection with Omicron. Until we know more, we should be cautious and take steps to slow down the spread of this new variant. But as we have seen before, reduced protection against infection and mild disease does not necessarily mean reduced protection against severe disease and death. Every time a new variant arises, vaccine developers have started work on a new version of the vaccine, and the same is true for Omicron. The work starts straight away, at risk, without waiting to find out if a change will be needed. But this may not be needed, and worked relentlessly in 2020 and 2021, without whom we would still be at the mercy